To be sick or being ill is something no one desires. A sick person becomes incapable of carrying out certain tasks. However, whichever the state in which a sick person or an ill one might be, he desires to enjoy all human rights. Further, all sick people have got extra rights called patient safety. In this right, health workers ensure that their patients are being treated and cared for in a safe and clean environment. Patient safety is described as a discipline that emphasizes the safety in healthcare facilities through reduction, reporting, and analysis of error and other types of unnecessary harms that often lead to adverse effects. In Zambia, the government, through various institutions like the Ministry of Health itself, Health Professions Council of Zambia, the Nurses and Midwives Council of Zambia, ensure that all health facilities, be it government, mission, or private, are correctly and consistently abiding by the patient safety rule. The Professions Council of Zambia has since produced many booklets, brochures, and posters in an effort to ensure that many people have been sensitized on their rights. At the international front, there is International Patient Safety Goals, which help accredited organizations address specific areas of concern in some of the most problematic areas of patient safety. For example, the theme for 2021 World Patient Safety Day, that fell on the 17th of September 2021, was Safe Maternal and Newborn Care. Zambia also joins the international community in commemorating patient safety. The team went to a women and newborn hospital at the University Teaching Hospital UTH and discussed the importance of patient care with the clients and healthcare providers.
This place is a referral hospital, so we receive mothers from different hospitals within Lusaka. So they come here for specialized care. So most of them, you find that maybe they have problems with their BPs, they could be having problems even with their weight, and they could be having problems even with their kidneys. There are various problems that a pregnant woman can have. So we check the BP to rule out any hypertension, and we also do the urinalysis to rule out any kidney infection. And if this woman has a raised BP, has it already affected the kidneys or not? So we'll check their urine to find out if there's any protein in there, which might indicate that the BP is affecting the kidneys. Then we also check their weight, because for every pregnant woman, as the pregnancy is progressing, we expect them to gain a bit of some weight. If the woman is not gaining, then we are worried as service providers, is this baby growing or is this woman feeding adequately? So that's the reason why we check their weight. And apart from that, we also want to check, are they gaining this weight rapidly? If they're gaining it rapidly, what could be the problem? We also look into that so that the woman is safe during the pregnancy.
Mrs. Chipo Mwembala is one of the clients at the hospital and appreciates the healthcare services she's been receiving since she was referred to the Women and Newborn Hospital, as she was found with chronic hypertension while pregnant.
Because 2 weeks ago, yenze nakwela maninge batapati wo natimankwala yasebenzaye.
However, she continued receiving treatment, as she now explains.
Nina problem pamene nankala na mimba. Nina problem ya mmala. So ninabwera kuno bananitandiza mmala munasiya. So pamene munasiya mmala banakamba ati muyambe antinento. So antinento ninayamba. So mmala kuchoka hapo munasiya. Bananipasa mankwala, akanikumwa mankwala ya BP. But apaniona ko at least kuchira pamene nabwera.
Mrs. Deborah Nyambin Shamba is the acting in charge in Labour Ward Unit and explains patient care in the Labour Ward.
Patient safety begins at the point of registration. Immediately a woman walks in. They are given a unique number, which will identify them, will isolate them from these other women. When a baby is delivered, the mother identifies the sex, and then the babies are given a name tag. They're addressed with a name tag. They are labeled. Each baby who is born, they have to be labeled. There should be a mother's name, time, date of delivery, the sex of the baby, and the birth weight. And then there should also be a unique number, the file number for the mother. So on infection prevention, we consider each and every woman who comes in as infectious, because we're dealing with body fluids. Number one, the midwives, the doctors, the students are asked to put on PPEs, gloves and gowns. With the COVID, you are seeing us with the masks at all times. And then whenever we deliver, the room is carbolized, the bed is carbolized. At each and every, after each delivery, all the rooms are carbolized. That has really helped us to fight the infection. What are we using? Simple chlorine, 0.5% for carbolization. And every quarterly we do fumigation.
Welcome to NICU.
Mrs. Lukia Mukonda is a registered midwife nurse at the Neonatal Intensive Care Unit and narrates how they ensure the newborns are cared for and remain safe while in their custody.
Here in NICU, there are feeding times where the mothers come in. So whenever the mother is coming in, they usually come in with an identification form at each visit when they're coming to feed the baby. If the mother is not sure where we've moved the baby, maybe the baby has stabilized, we moved out of acute, we've put on another cot. If she's not sure, she hasn't seen the baby, we help the mothers. We just get the identification form, look for the baby using the name tag and compare the information on the file. In instances where the mother has come in the unit without an identification form, we don't allow that mother to come in because it can be any other person coming here to claim to say, I have a baby in here. So the only surety that we have is an identification form which is stamped to help identify the baby. Then we've got instances whereby maybe the baby was a C-section baby, the mother is still under general anesthesia, then the relatives wants to see the baby or the father wants to see the baby. We always advise the father to go to the ward where the mother is, collect an identification form and come over to NICU and identify the baby, then they can see the baby.
At Women and Newborn Hospital, a triaging system has been put in place to ensure that all emergencies get the much-needed attention and care.
So basically, this unit is an obstetric triage. So it's the first point of contact for patients that are referred to UTH Women and Newborn Hospital. So it's strategically located on the ground floor near the ambulance bay so that patients are able to receive the care as soon as they get here. And so for patients that come here, they're usually in a critical condition. And being that they're in a critical condition, patient safety is very important. And as such, these patients are wheeled from the ambulance on an ambulance trolley straight onto our beds, which are railed beds. Because railed beds are ideal for such patients because they protect them from falling off the bed. And as such, patients are nursed in this manner throughout their stay as they're being stabilized. Patients usually come in with different conditions. Some would have maybe history of fitting, or some would be having history of having bled a lot. So these are patients that are really not aware of their situation. They're quite critical. And so that's why patient safety becomes very important, so that you offer the adequate care the patient needs during that time of need. And so some of the things that we do is we stabilize the patient because sometimes they'll come in shock by putting in place interventions to help them come out of that situation. Yes.
A check at Kangaroo Mother Care KMC ward revealed the secrets to the continued reduction of infant mortality in the country.
When the mother is brought here from neonatal intensive care unit with a premature baby, the mother is taught how to care for the baby. The first thing that is taught to the mother is infection prevention, knowing the immunity of these babies is not yet fully developed. So the mother is taught how to do hand washing. The mother is taught how to bath. The mother is asked to use the clean top, which is open, so that every day the baby is put on KMC. These mothers, they bath 3 times in a day because of sweat, knowing that our babies are small, are vulnerable, they have no immunity. The mother also is taught the importance of KMC or the benefits of KMC. The mother is taught that when you put the baby on KMC, the baby will be warm. So we are just imitating the uterus or the womb where the baby was. So when the baby is put on KMC, the baby will be warm, will take the heat from the mother. Therefore, prevention of hypothermia or prevention the coldness. And when the baby is put skin to skin, so that the baby is able to get the heat from the mother. Then the mother also is taught that Kangaroo, when the baby is put on KMC, it prevents apnea or it prevents the baby from stopping to breathe, knowing that the respiratory center for this baby is not well developed. So the premature baby tends to stop. There are times when they stop completely breathing. So to help this premature baby to breathe, as the mother is breathing, is able to push the chest of the baby, therefore encouraging the baby to breathe. Then the other thing, when the baby is put on Kangaroo, the mother will be reminded of feeding, because the premature baby feeds every 2 hours. So when the baby is put on Kangaroo, it will help the mother to remember that now it's time to feed the baby.
So all these teams work together to ensure that safety of the baby is also promoted and enhanced as the babies are being nursed in the neonatal unit. So what we also begin to see is that safety of the patients that come in the hospital is not only attained by the nurses and midwives alone. It is attained by working in a team that collaborates together, where we have the obstetricians, we have people in the laboratory, the biomedical scientists who run the specimens for us, we have the radiologists, we have the pharmacists who give us the medications, we also have the biomedical engineers who take care of the equipment, which is very, very critical in ensuring that as we use this equipment, our patients are safe through and through. Therefore, teamwork enhances services delivery and safety of the patients. But other than ourselves in healthcare, you find that even the community is part of the team that also plays a role in ensuring that safety of the patients, especially obstetric women and the babies that they come here, is actually enhanced, because these women come from the community, and the community is the family, the community are the people that they live with. So community, healthcare providers, and all the peoples around contribute to safety of the patients. In my closing remarks, I'm saying that with improved safety of the patients as we provide healthcare, we send them home in good time. They go and integrate with the community, and they're able to carry out their daily activities. And when they carry out their daily activities, they actually add to the economy, thereby improving the status of their families.
In conclusion, patient safety is the cornerstone of modern healthcare delivery systems because it's inextricably linked to the quality of care. We require continuous long-term efforts by healthcare systems to enhance patient safety, and this can only be achieved if everyone understands the gaps in the safety of the clients or patients. Together, we can attain our long-term desire for safety in our institutions.